It's important to understand that heart disease in the youth has actually increased over the last 50 years. In India, heart disease has increased by 300% over the last 30 years in general.
What is the difference between a heart attack and a cardiac arrest?
A person starts having severe chest pain, congestion, sweating, ghabrat, and that is because the heart muscle is getting damaged and it's heart attack. The cardiac arrest is a situation where the heart stops suddenly. Us to see someone at the age of 24, 22 getting a heart attack.
That COVID vaccines have actually caused this increase in heart disease or heart attacks.
When we talk about less than 20 years, yes, a person can have a heart attack. Do heart attacks actually increase in women and during pregnancy? We must remember,
How do I know that my heart is doing okay?
is high blood pressure, diabetes, raised cholesterol, and that family history. But stress तो हर एक को होता है जिंदगी में, after all.
Hello and welcome to HealthWire Chat, brought to you by HealthWire. We bring to you this video podcast where we speak to global specialists on a subject that concerns your health. And this week we are delighted to be joined by Professor Dr. Ashok Seth, Chairman of the Fortis Escorts Heart Institute and a household name on everything on relating matters to the heart. Dr. Seth, welcome to HealthWire Chat.
Thank you, Karan. It's a pleasure to be on the HealthWire.
Thank you. And we wanted to have a discussion around heart attacks and the young Indian.
Correct.
The demographic dividend that India has is amongst its young and the youth.
I agree.
But unfortunately, we're also seeing or witnessing cases that one hears about of the young getting cardiac arrests and having mortality as a result. So we just wanted to discuss that subject with you and dig straight into the first and most important question. Can young people get heart attacks?
So you're absolutely right, Karan. Yes, we've seen a greater incidence of heart attacks and deaths from heart disease more recently in the young. And of course, those sad visuals are genuinely an increase in heart attacks, but also in a way captured by the social media and in a way bringing more awareness about heart attacks in the young. It's important to understand that heart disease in the youth has actually increased over the last 15 years. And there's been a 300% increase in that. And what we're talking about is that earlier heart attacks and heart disease used to be something which would affect the elderly, say beyond the ages of 60. And it was rare to see anything less than 50 to have a heart attack. Now, 25% of our patients who have heart attacks are less than age 40. And that's a big increase over the last 15 years. We also need to understand that age, at the average age in which heart attack is occurring in India, is 10 years to 15 years lower than the West. In fact, in India, heart disease has increased by 300% over the last 30 years in general, while in the West, death from heart attacks are decreasing. We as Indians are 3 times more predisposed to the West Caucasians, 5-6 times more prone than Chinese, and 20 times more than Japanese to actually have heart attacks and heart disease. But the concern absolutely clearly is the fact that it is increasing in the younger age group, and there are specific reasons for it. And because you actually said that 50% of our population is youth, it's so important to be able to know the causes, to prevent it. And it is a concern that as heart disease goes also on with age, what would happen in 10 to 15 to 20 years' time to this very youth who's predisposed to heart disease at this stage, which is premature heart disease.
Thank you, sir. Thank you for laying out the lay of the land, as it were. But we sometimes use terms very interchangeably. And I think for our viewers, it will be good to decode a few of those. One is, what is the difference between a heart attack and a cardiac arrest?
It is an important question again, and it does need to be clarified, because these terms of heart attack and cardiac arrest are used interchangeably without understanding what it actually means. See, heart attack is a situation where there are blockages in the arteries of the heart. These are the arteries that supply blood to the heart itself. And if there are blockage, and on top of that, suddenly a clot gets stuck and the artery which supplies to the heart muscle gets suddenly blocked 100% with no supply, a person starts having severe chest pain, congestion, sweating, घबराहट, and the syndrome of doom. And that is because the heart muscle is getting damaged and it's heart attack. And usually that's the sign which is so bad that it's going down the arms, there's nausea, vomiting, and then patients rush to the hospital and specific treatment like angioplasty is done to open up the blockage and suddenly stop the attack. Now, cardiac arrest is a situation where the heart stops suddenly. It stops beating. There is no heartbeat. And in a few minutes, the blood to the whole of the body is gone. And it's a situation which, if in a few minutes the person is not revived, it goes to death. It goes to irreparable damages to the brain, kidneys, every organ, and therefore it's death. So cardiac arrest is an emergent situation of stopping of the heart. One of the commonest causes, at least in the adult, when a cardiac arrest occurs, one of the commonest causes in 85% of those, in 90% of those, is a heart attack. Because 10% of the heart attacks, when they start and the artery gets blocked, will suddenly stop the heart. And that is why heart attack is one of the commonest cause of the heart suddenly stopping. In the young, less than 20 years, there could be many other causes of a cardiac arrest. But in India, beyond the age of 25, beyond the age of 30, the commonest cause of heart stopping suddenly and a person collapsing and dying in front of our eyes is a heart attack. Luckily, that happens in a small proportion of patients. The remaining are able to get to the hospital and seek treatment for the heart attack so that cardiac arrest or damage to the heart doesn't occur. So we have to dissociate these two. One is an emergency of immediate death if not revived within a few minutes. The other is a symptom of an attack which requires urgent solution but is best treated as fast as possible, but the person is alive.
So you touched upon the 20s, people who are in their 20s. And you also spoke about Indians being more predisposed at a younger age to heart disease and therefore, heart attacks and so on. So can a person in their 20s also get a heart attack?
Yes, we've seen the age getting younger and younger for heart attacks. I can actually tell you that 20 years ago, 15 years ago, it was very rare. And I've been practicing interventional cardiology now for 40 years and 35 years in this country. I, 20 years ago, would not see anybody less than 30 having a heart attack. Now it's fairly common for us to see someone at the age of 25. I wouldn't say very common, but yes, it's not unusual for us to see someone at the age of 24, 22 getting a heart attack. When we talk about less than 20 years, yes, a person can have a heart attack if he's got certain of those disorders which transmit in the family, like extremely high cholesterols, which lead to premature blockages, or someone who's extremely heavy smoker or does extremely vigorous exercise relating to blood clotting. Yes, heart attacks can occur in certain illnesses which lead to blood getting thick and clotting, and more recent times, COVID was one of those causes where the blood would clot up and suddenly cause a heart attack. But usually, what you see less than 20 years of age and you see somebody who's sort of 15, 17 suddenly collapse and have a cardiac arrest, those are usually, the earlier the age, the less than 20, those cardiac arrests are more related to congenital abnormalities of the heart which were not diagnosed, disease processes like thickening of the muscle of the heart called hypertrophic cardiomyopathy, which transmits genetically and can lead to sudden cardiac arrest. There are rhythm disorders of the heart going extremely fast, again congenitally transmitted, which can lead to sudden cardiac arrest, holes in the heart, cardiomyopathies where the heart gets weakened. All those are examples usually. So in less than 20, I would say 80% of them are related to these factors, which are not due to blockages in the arteries of the heart, but thickening either of the blood clots or congenital abnormalities of sudden cardiac death. But it's important to understand, beyond the age of 20, we see more and more heart disease, more and more blockages. We also see, by the way, those individuals who smoke heavily or do severe exercise. even if they have minor blockages of 20%, 25%, 30%, which are not manifested, which don't cause any symptoms, but if there is heavy smoking itself leads to clotting of the blood. Suddenly that 25-30% blockage ruptures and the artery gets blocked. And we see regularly such young individuals who are heavy smokers coming in with clots filled in the arteries, having a heart attack. And it actually leads, the younger the age, the bigger the heart attack, the more dangerous the heart attack. And that is why we see those visuals sometimes which are sad, as I said, but again, they are informative, or at least they wake us up to the reality that young individuals can get a heart attack, and a small proportion of them will suddenly collapse and die in front of our eyes, if not revived. So those are the facts which have to enlighten us to prevent heart attacks at every age.
Right, and we, no conversation is complete without a very critical demographic, which is young women. And there has been some talk about pregnancy being a risk factor for causing heart attacks. Is there any truth in that, or what does the science say and your experience say?
Yeah, I think we must remember that heart attack is not just a disease of the male. Even women, the single largest cause of death in women is coronary artery disease and heart attack. 6 times more than any cancer of the women that we talk about. And there's a lot of awareness about cancer in women and prevention and so forth. There's less understanding of this fact that women actually, the biggest cause of death in women is heart disease, blockages. In women, heart attacks have grown by 200% again over the last 25 years. This needs to be prevented and well understood. So when we raise these issues about prevention of heart attacks, and we will raise more about that as we go along, it is both for men and women uniformly. Treatment also lies around the same patterns. Investigation lies around the same patterns. I think we just have to consider the whole population together. About the women and pregnancy and heart disease. Do heart attacks actually increase in women during pregnancy? We must remember that pregnant ladies are usually young ladies in their earlier age groups, where heart disease is usually rarer. Blockages, heart attacks are usually rarer. But it's been also demonstrated that the hormonal changes during pregnancy lead to thickening of the blood, or can lead to thickening of the blood, and undiagnosed disease can get exacerbated and worse. For example, valve disease, unpicked, disease called mitral stenosis, unpicked at the time of pregnancy, starts getting manifested with breathlessness. There are other changes which happen. High blood pressure, we call it preeclampsia. Blood pressure rises tremendously, can put a strain on the heart, can actually lead to breathlessness, heart failure, fluid accumulating in the lungs. Those are very important causes. The third aspect is cardiomyopathy, or the heart can get weakened just prior to the delivery. So during the gestation period, a number of heart disease can happen suddenly as a result of hormonal changes of pregnancy, or can be precipitated by the hyperdynamic circulation, and the valve disease can get manifested. Congenital heart disease can get manifested at that time, which was never symptomatic. And yes, it's been also said that there's slight increased incidence of heart attacks in those who got some blockages or the other, which were not manifested before. But the other big issue is really heart disease which pre-existed, valve disease which pre-existed, congenital holes in the heart which pre-existed get worse, and then finally, of course, we just discussed high blood pressure is a real problem, which is why women during pregnancy are followed. That starts suddenly and can rise extremely high, and then this weakening of the heart muscle in the last 4 weeks to 8 weeks of pregnancy, where the heart gets weaker, and that can actually happen even after pregnancy. So, but these are all rare. I mean, we shouldn't think that, pregnancy is associated with the heart problems. No, these are rare. That is why we say that every pregnancy is definitely followed up by the obstetrician, and wherever the obstetrician feels the need to involve someone else, a cardiologist maybe an echocardiogram as simple as that, the regular checks of blood pressure, That's all that's done to keep a pregnancy safe and well to the time of delivery.
Let's segue to another part of this conversation. You've been one of the earliest proponents in India and around the world on prevention. So I want to talk a bit about that. First up, how do I know that my heart is doing okay?
Yes, I think it's important, and all that we've talked about cardiac arrest and heart attacks, and we've differentiated those two. And heart attacks being the most important presentation of, say, blockages in the arteries of the heart, because heart attacks is what leads to death, what leads to damage to the heart muscle, what decreases longevity of life. We must know the risk factors. We discussed why has there been an increase, and I think it's an important aspect also to discuss why has there been an increase in the last 15 years in the incidence of heart attacks, especially in our youth. And it's fairly obvious. There's been an absolute major change in lifestyle as we see now compared to 20 years ago. It relates to stresses. Firstly, let's talk about the common things first. It relates to increase in smoking and alcohol intake. There's no question. More people smoke now than they used to smoke earlier. In addition to the usual causes, which we call of diabetes and high blood pressure, which exists even in the elderly, which exists at any age, the specific key factors which have really precipitated heart attacks in the youth in the recent times is a whole lifestyle change. And the lifestyle change revolves around irregular habits, firstly. Secondly, there are stresses of work and life, complete imbalances where our youth has to meet deadlines. Our youth has to meet competition. Our youth is keeping different time zones because they may be working at night across different time zones in the world. Our youth has got irregular heating habits, and our youth also has the less of exercise because most of the jobs are desk jobs working across the world. There's obvious change in eating habits whereby fast foods, foods like burgers and pizzas and getting it from, say, various restaurants has become a part of a natural life because of the time constraints. Irregular sleeping hours. Some actually sleep in the daytime because they've got to work at night. Others sleep only for 4 hours because they've got to meet deadlines. And all these have led clearly to, all are known to cause heart disease. And then on top of that, add a lack of exercise, add obesity. Again, increase in heart attacks and heart disease, blockages of the arteries of the heart. And I'd say more recently, it's been pollution. Pollution has been shown to increase the incidence of heart attacks and heart disease. And our youth is traveling on the roads in most of the cities which are more polluted than anywhere else in the world. And again, that's something causing inflammation. That sulfur dioxide and carbon monoxide are all causing inflammation in the arteries of the heart. And finally, of course, more recently has been COVID itself, which has precipitated an increase in heart attacks. So we therefore are worried about our youth. And that is bring us to the point that what do we do actually firstly as a checkup and secondly as a prevention. And I can tell you that prevention of heart attacks is in our hands. If I was just to say that if you actually exercise, and by exercise I don't mean lifting heavy weights and making the muscles in a manner that you would look physically Superman. It is exercise for the heart. And what we mean by that is simple. 200 minutes of exercise a day, which actually translates it to 40 minutes of exercise 5 times a week. And exercise means brisk walking is the best exercise. 5 minutes warm up, brisk exercise, 5 minutes warm down, decreases the possibility of having a heart attack by 25%. Now, not just that it decreases the possibility of heart attack by 25%, it does it by many methods. Exercise is the best methodology to control blood pressure. Exercise is the best methodology to control diabetes. Exercise is the best methodology to decrease stress. It is the best method to lose weight. It's the best method to keep the cholesterols down. It is actually the best method to give positivity and a sense of well-being. In decreased stress, in every way, exercise actually works by these multiple mechanisms of decreasing all the risk factors. So So the prevention of heart attacks is not in our hands, it's actually in our feet. It's as simple as that. But on the other hand, I think it's also important to understand that we need to get rid of bad habits and lead healthy lifestyle and try and sleep for 7 to 8 hours. We need to relieve our stresses, and everybody will say, but stress तो हर एक को होता है इस जिंदगी में. After all, हम बैठे हुए हैं, कहीं ना कहीं किसी का स्ट्रेस है, हर एक को डिफरेंट तरह का स्ट्रेस है. किसी को जॉब का स्ट्रेस है और किसी की जॉब अच्छी है तो घर का स्ट्रेस है, और उसके घर में कोई स्ट्रेस नहीं है तो बच्चों की पढ़ाई का स्ट्रेस है. तो किसी न किसी को कहता है कि घर में काम वाली नहीं है, उसका ही स्ट्रेस है. So stress though life का एक part है, even driving on the roads is a stress, but it's how you actually tackle that stress. How does your body respond to that stress? Mental relaxation, yoga, friends, hobbies, singing, all are an important aspect of preventing stress on your body. So it's relief of stress. And I think while I'm addressing this, and I know I'm telling you a lot of things, another aspect people say is कि मेरे को exercise करने का time ही नहीं मिलता. मेरा I've got a work schedule. जब मैं 16 घंटे काम करता हूँ, टाइम नहीं मिलता. And I want to put that to every youth, and I want to put that to every listener across. Because any of us is predisposed to heart disease, even myself, as I sit here with the best of habits. Any of us, just being an Indian, is a risk factor for heart disease, as I explained earlier. We're genetically also predisposed to having heart attacks and heart disease. So we therefore have to know that if we've got a time to read a newspaper, then we have time to look after ourselves as well. If we say that we actually had a cup of tea for 15 minutes, then we have to add another 15 minutes for ourselves as well, for our heart. This has to function for every second, every minute, 24 hours a day, for 365 days a year, till our lifetime. So this is what needs most care. It's so easy. If you're going to work, if you're going to catch a metro, make sure that you park far away from the metro, or you get dropped from the metro at least 5 minutes away so you're able to walk to the metro. Make sure that don't use lifts in your office, just climb stairs. Make sure that 1 hour or at 12 o'clock or 11:30 you say, I've got a tea break, I must go to the canteen and have a samosa and chai with my friends. Make sure you don't do that. Make sure you say, at 15 minutes, I'll just go out for a walk. It's as simple as that. When you come home, make sure that you get dropped way away from your home, so you walk to home. By the time you finish all that, you've done your 30 to 40 minutes of exercise, fitted it into the time when you otherwise thought I'd have 3 cups of chai and perhaps a samosa at the tea time before lunch, and perhaps 3 biscuits and chai in the evening before you get home. So it's so easy in your life.
And thank you for putting it out so brilliantly, because this is real life examples that you've given of how we can modify, how. And
I think the next one we'll talk about is checkups.
Yes.
I wanted to firstly emphasize the prevention as we see it in our daily life.
Yeah. So if after hearing you, a person is concerned about themselves, they may have had predispositions, because of genetics or family history or poor habits. What are some of the tests that people should undergo regularly, or what should the regime look like?
So we've talked about how to lead a good, healthy life and try and get rid of the risk factors. But it's also very important to understand checkups are important as well. And the questions which get asked regularly is, do I really need checkup? I mean, I'll lead a healthy life and I'll put myself in a healthy life. Do I really need checkups? Yes. And let me guide you. These are not exhaustive checkups of high-flown tests that we need to know whether we've got heart disease or prevent heart disease. But it's just understanding your own risk factors. Like I said, prevention of heart disease in our hands, but prevention of heart disease is also our own responsibility in multiple ways. We have understood the risk factors of heart disease. And we just talked about the stress, and we talked about irregular habits, we talked about obesity, we talked about maintaining right food, so on. But what are the important risk factors also is high blood pressure, diabetes, raised cholesterol, and that family history. So we always say that if someone in your family, whether it's father, mother, has had a heart attack or sudden cardiac arrest, at an early age in life, which means less than 60 on an average, that is a very important message for your own self, including my own self, that I need checkups right at the age of 20. There was something which caused a heart attack in them at the early age. Maybe that's been transmitted to me, and that is why I'm already a predisposed person to having heart disease. That is the first message. Family history at an early age of having heart problems. Brothers, sisters. The second aspect is that it is possible that it was not just genetic transmission, but it's also cholesterol transmission. That if somebody's had heart disease at a very early age in my family, I could have just raised cholesterol levels, which could be exceedingly high, predisposed to early development of heart blockages. Do you know that it has been seen and proven that heart blockages, if there's raised cholesterol, heart blockages, in fact, cholesterol deposits in various arteries of the start can start as early as 5 years and 10 years of the age. So we may be already getting blockages by the age of 20 if we didn't know and didn't follow our family history. If there is no strong family history, but I'm a smoker, then of course I need regular checkups, because again, that's a major predisposition. If I'm a diabetic, I need it. But and I've got high blood pressure, I need regular checkup. But how do I know I've got diabetes or high blood pressure? Smoking is fine. I need to give it up. It's a bad thing. It's actually the biggest taboo that I would actually emphasize right now, that anybody who's a smoker is predisposing himself to even early heart attacks at the age of 20, 22, 25, could have a major heart attack. But if we just talk about, I have no family history, I seem to be a well individual, I'm not overweight, that's the time that I think all Indians, even if looking healthy, by the age of 25 to 30, should only go to a doctor just for checking their blood pressure, their diabetes, and cholesterol. The reason is that nearly 25% of our patients, 30% of Indian population has high blood pressure. This diabetes exists in 20% of our population. We need to know just by a simple blood test whether we are predisposed to diabetes, whether our blood pressure is high, is okay or not, and by a single blood test to know our cholesterol levels. We need to know, every male need to know this by the age of 25 to 30, every lady needs to know it by the age of 30 to 35 to 40. Those obviously who have risk factors should get themselves followed more. But if we do have these risk factors, then at least we know what to prevent, what to take care of. So the control prevention lies in our hands, and I say that it lies in our hands is only because it's know your risk factors. The risk factors are well recognized. A simple visit to a doctor tells you your risk factors. And by the way, the reason it's important to visit to the risk factors, and that can be a GP yourself, your local GP, is because high blood pressure has no symptoms. Diabetes does not give symptoms. High cholesterol does not give any symptoms. So you feel you're apparently well when everything inside the body is going wrong, till your doctor diagnoses it with simple BP measurement and by simple blood test. So know your risk factors right in the beginning of life. If there's a family history, you know it by the age of 20. If there's no family history and you're apparently well, not overweight, not smoking, know it at least by the age of 25 to 30, so that good measures can be taken. If there are no risk factors, then you can have a checkup every 5 years just to make sure that nothing has happened in between. But if you do have risk factors, then rely on your doctor and the cardiologist to have simple tests like echocardiogram, to have simple tests like exercise tests, so that disease processes, if they develop, can be caught early. I want to emphasize one more fact, and I think the fact always remains around this question arising in your minds that, but he used to exercise so well, or that person exercised and he was so fit, and then suddenly had an arrest or suddenly had a heart attack. And that mind is in a confusion that how could that healthy person who was exercising so well and used to exercise for 2 hours a day in the gym suddenly had a heart attack and didn't survive. So the answers are fairly obvious in medical science to that. The answers are 3. Firstly, if a person is a smoker and maybe gymming heavily, but that severe exercise can create a blood clot, and actually it's the worst thing which happens, is a smoker who does severe exercise, like running, like marathons, like going for 10 meter jog, 10 kilometer jog, or a brisk competitive run or heavy exercise. Clots can form and sudden cardiac arrest can happen. Secondly, blockages don't cause any symptoms till they get beyond 70% of artery getting blocked. Till that time, a person assumes that he's fit and fine because there are no symptoms and there are no tests being done. And yet, any of those blockages can also cause a heart attack by a clot sticking on it through severe exercise, and that can cause. So therefore, that checkup issue comes in important when going for aggressive exercise or extreme sports, or joining a gym, or for that matter, going for heavy gymming, or for that going to extreme sports. Absolutely required. A proper checkup by a cardiologist is always required. And of course, some of these could be congenitally transmitted disease processes which get unnoticed and on severe exercise. That's happened to, you've seen those news about footballer in a football field suddenly hitting a goal and then collapsing. Those are congenitally transmitted diseases rather than heart attacks happening. So it's very important to understand the mechanism, and that's why we say heavy weight lifting is not a heart healthy exercise. It's aerobic exercises are the best exercises, like brisk walking, cycling, rowing, light jogging even. But severe exercises like heavy weight lifting, are good for bodybuilding, good for stamina, good for looking good, but are not necessarily equivalent to heart health. And that's why the two have to be differentiated, dissociated, and before going for extreme bodybuilding, etc. So those are the two differences why people say, oh, but he was fit. But he may not have been fit. He had great muscles. And then, of course, add to that, people who build muscles also start taking certain artificial substances and hormones to build those muscles up. And that, of course, is known to be harmful for the arteries of the heart and create heart attacks, and for the kidneys as well. So I think we have a lot of myths happening around, which is what I wanted to clarify.
That's perfect, and thank you for that. I think this has been really useful. It's simple but comprehensive advice. But before we sign off, you touched upon myths, and one myth that is out there is that COVID vaccines have actually caused this increase in heart disease or heart attacks. Could you bust that myth for us once and for all?
Yes, I'm surprised that myth came ever. COVID was the biggest destruction. It stopped mankind in its tracks. It stopped humankind in its tracks, I would say. And there's no question whatsoever. Every data across the world, including India, has demonstrated that COVID caused an increase in heart attacks and heart diseases by 300%. And it was so obvious, not just in not just during the COVID, during the infection. Beyond a month, at 3 months, at 6 months, at a year, up to a year, it continued to cause the havoc after just an infection. And it was in many ways. It was an increase in clotting leading to heart attacks. It was irregular heartbeats and arrhythmias leading to sudden collapse, leading to palpitations, leading to breathlessness, infecting the heart muscle, leading to weakening of the heart muscle. In fact, very early on in 2020, June, I wrote an opinion in one of the national dailies which said COVID is not just a lung disease, it's actually a heart disease. And so there's no question. And by the way, not just happened occasionally and rarely. 20% of the people who died, 25% of the people who died from COVID died from heart problems rather than from lung problems. It was just huge a number. So we actually know that COVID affected and it was also demonstrated so easily, especially during the second wave, that if we even did MRI scans on a person who had mild COVID and came home and said, I was feeling apparently normal, MRI scans on them showed affected heart muscle and inflamed heart muscle. So practically, this was an affection of more than 5 to 10% of the people getting affected from heart problems from COVID, and dying was 25 to 30% who died. So therefore, we've got to understand that COVID was a heart disease. COVID vaccine saved us. And don't ever think that COVID vaccine had any side effects leading to heart attacks. I want to state that side effects, a complication, is extremely rare from vaccine, but happens with every vaccine. Every vaccine that we've taken from our childhood to now, and the 20 different vaccines, right from diphtheria and flus and tetanus, etc., all have had those side effects, which is 1 in 100,000 may get some affection of any side effect. You're talking about 0.001%. And yet COVID affected 10 to 20% of people who got COVID were affected by heart disease in some manner or the other. So there's no question that COVID vaccine saved us from not just COVID, it actually saved us from heart attacks and heart disease in multiple ways. It saved us from the lung and it made us survive. And we should continue to look at every aspect of the scientific facts which were put together to prove this very fact that vaccines are a savior for us, will continue to be a savior. And it's very important for us to actually separate out the two facts. You know, there's masses of data now have accounted for those who did not get the vaccine to those who got the vaccine, those who got the vaccine and heart attacks, and follow-up studies which goes into lakhs in the West. We are less able to follow up our population in lakhs, but we are able to follow up our population in thousands of specific groups. But in the West, it goes into lakhs and lakhs of follow-up over the period of a year, 2 years, 3 years, those who got vaccine, those who didn't get vaccine, those who got which vaccine, how many doses did they get, what was their follow-up, all has been actually proven very completely. We are safe because the vaccine was there.
Thank you for that, and thank you for that wonderful message on protecting our heart. Dr. Seth, thank you for joining us on HealthWire Chat. That was Dr. Ashok Seth, who joined us for this episode of HealthWire Chat. Do join us next week as we will speak to another specialist, and in the meantime, do share and subscribe to HealthWire Chat so that we can get the message of good health to as many people as possible. Till next time, stay happy and healthy.